Hi everyone, welcome back to my YouTube channel. Today I will be talking about MedPAC's vote to recommend no payment bump to physician fee schedule in 2023. Let's jump right into it. MedPAC's January 2022 public meeting was held virtually via video conference in which they discussed and voted on payment adequacy and payment updates for physician and other health professional services. MedPAC assesses the adequacy of Medicare's payments for physicians and other health professionals by examining the areas of access to care, quality of care, and clinicians' revenue and cost. The physician fee schedule is used to pay for about 8,000 different services that are provided in a variety of settings. MedPAC staff stated in the meeting that in 2020, Medicare paid $64.8 billion to 1.3 million clinicians for fee schedule services. This is $8.7 billion less than what was spent in 2019 before the pandemic. To offset declines in revenue from Medicare and other payers during the pandemic, Congress has provided tens of billions of dollars in relief funds to clinicians. In addition, Congress and CMS gave clinicians much more flexibility to provide telehealth services. Under current law, there is no update to the base payment rate for 2023, but clinicians can potentially receive a positive or negative performance-based adjustment if they are in the merit-based incentive payment system known as MIPS, or they can receive a 5% bonus if they are in an advanced alternative payment model. Congress increased physician fee schedule payment rates in 2020 and 2021. Since their last meeting in December, Congress also increased payments for 2022, and they are nearly 4% higher than they were scheduled to be under prior law. In January 2023, these temporary payment increases will expire, and clinicians' payment rates will return to pre-pandemic levels through 2025. In 2026, differential payment updates will begin for clinicians in advanced alternative payment models and clinicians who are not in advanced alternative payment models. As far as payment adequacy analysis is concerned, it was stated that although COVID affected their indicators of payment adequacy, they remain generally positive. Most beneficiaries report access to care that is comparable to the privately insured and to prior years. The number of clinicians billing Medicare is stable, and the number of clinician encounters per beneficiary declined in 2020 due to the pandemic. Turning to quality of care, they found wide geographic variation in the rates of ambulatory care-sensitive hospital use and CAHPS patient experience scores remain high. However, it is difficult to interpret quality measures in 2020 due to the effects of the pandemic. In terms of clinicians' revenue and cost, Medicare payments to clinicians declined by $9 billion from 2019 to 2020, but clinicians received tens of billions of dollars in relief funds to offset financial losses due to the pandemic. Medicare payments per beneficiary decreased in the spring of 2020, but then rebounded and almost reached pre-pandemic levels by June. The Medicare Economic Index, or MEI, is projected to continue growing. Commercial payment rates for clinician services continue to exceed Medicare rates, and physician compensation from all payers increased modestly between 2019 and 2020 despite the pandemic. This led them to the first draft recommendation, which reads, for calendar year 2023, the Congress should update the 2022 Medicare base payment rate for physician and other health professional services by the amount determined under current law. The Commission expects that there would be no change in spending compared with current law, which calls for no update. It was also stated that this should not affect beneficiaries' access to care or clinicians' willingness and ability to furnish care. The MedPAC staff also stated, quote, "It is important to note that the payment update applies to all clinician services. If there are concerns about payment adequacy for primary care services, they should be addressed through a targeted approach instead of the payment update mechanism. In addition, we will continue to monitor our indicators of payment adequacy each year using the most current available data, and we will make recommendations accordingly in future years." MedPAC unanimously voted to recommend no change to the Medicare physician fee schedule for 2023. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.